Hi, good afternoon to all of you. Uh, this is Vikram. I'm one of the founders of Ananta Hemfox, and today we are again at Wednesday 3 o'clock. We are here with you, all of you, for another Ananta Sambhasha session. Today we have Dr. Payal Khandelwal with us. Before I give an introduction, I would just like to introduce the company to you. Ananta Hemfox is a medical cannabis-based company, and we have three main lines of products, which is the cosmetic line, the nutrition line, and the medical cannabis Vijaya leaf extract medicines, basically. Uh, I'm just sorry, just 1 second. I think the voice is echoing. Something wrong. Is it better now, ma'am?
Yeah.
मैम आई थिंक आपकी तरफ से पहले कैन यू जस्ट म्यूट योरसेल्फ दिवेश जी वॉइस
Yes,
बेटर
sir.
है
हाँ अभी ठीक है.
हाँ तो पहले जस्ट कीप योरसेल्फ ऑन म्यूट व्हेन आई एम टॉकिंग बिकॉज़ आई थिंक वो वहां से रिवर्स आ रहा है सॉरी. So coming back, Ananta Hemfox is a medical cannabis based company and हमारी तीन main lines हैं, nutrition line है, cosmetic line है और medicine line है. As a vision of the company, we guys want to connect with maximum of doctors, and we are focusing on a bouquet of medicines in which we are able to provide all the doctors with this medicine, and we have a lot of delivery systems like sublingual, we have tablets, capsules, we have topical application products. And our main idea and scope is that हम इस medicine को main streamline में लेके आ पाएं, and all the doctors like yourself are able to use this medication with full knowledge and full confidence. We have seen very good results of this medicine since the time we have been in this industry, and there are more and more doctors which we are connecting every day. We are available in plus 100 clinics right now with doctors like Dr. Payal Khandelwal herself. And it is because of these doctors that we have so much of confidence now, because the medicine's real result through the patients are coming in. We have also have a vision of doing clinical trials, which we have already started, so that more and more data is available. और ये डेटा हम सारे डॉक्टर्स के साथ प्रोवाइड कर पाएँ, शेयर कर पाएँ. ये अनंता हेमफॉक्स का विजन है. एनी डॉक्टर हु इज देयर टुडे, who wants to connect with us, who has any questions, who has any queries, they want samples or anything like that, please, I will be sharing my number on the chat box. Please take it from there, or you can get in touch with the Indian Vedas. They will give our details to you, and I'll be happy to be connected and give you more information. I would like to introduce my speaker now, Dr. Payal Khandelwal. Dr. Payal Khandelwal has done a graduation and post-graduation in Ayurveda from the prestigious Institute of Tilak Ayurveda Institute in Pune, and she has worked for the last 15 years in the capacity of an Ayurvedic consultant, research associate, and a lecturer. She has been awarded the National Herbal Research Award by Madhya Pradesh government in recognition of her contribution to clinical research in the field of generalized anxiety disorders. She has worked with internationally recognized institutes like Ayurveda, Rasyani Pune, Rasyani Biologics Private Limited, Pune Million Eyes Healthcare Technologies, etc. She's based in Whitefields. The brand name, the clinic name is Ayurveda First. Ayurveda First is the brainchild of Dr. Payal Khandelwal. She's a senior Ayurveda Panchkarma and a Garb Sanchakar consultant at Ayurveda First. Various research-based protocols based upon Ayurvedic principles are followed at Ayurveda First for treating chronic ailments, including Panchkarma and Rasan therapies for the best result. The expertise in treating lifestyle and chronic diseases, especially infertility, insta pain management with Ayurveda, skin disorders, gastrointestinal tract disease and liver disorders, hormonal disorders, gynecological disorders, immunity and allergic conditions in children and adults both, anxiety, stress and mental health disorders, wellness and preventive healthcare with Prakriti diet consultation and Nadi Pariksha. Dr. Payal is also recognized as a medical cannabis and excess bar practitioner, Ayurveda First, in her initiative to bring personalized, preventive, corrective, and curative healthcare solutions to help treat chronic and critical illnesses. With a passion to get real Ayurveda in people's life, as a range of products for skin and health and hair care, hair health have been developed under her brand Ayurveda First, which are chemical-free, safe for skin and hair type. We are today going to be discussing anxiety, insomnia, and medical cannabis with her. Not taking too much of your time, I would like to pass on the conversation to Dr. Payal. Dr. Payal, thank you so much for joining us, taking out this time and collating this so much of information for all the doctors. I hope आज जो हम ये presentation कर रहे हैं और आपने जो ये presentation बनाई है, इससे बहुत सारे doctors को बहुत information और काफी फायदा मिलने वाला है. So Dr. Payal, please go ahead. Thank you.
Thank you, Vikram, for introducing me so nicely, and a very warm welcome, a very good afternoon to all the doctors, practitioners here, and all my friends who are going to share this platform with me today, and Ananta hence. Thank you so much, and big thanks to Indian Vaidyas for letting me also present my work on this platform. Thank you so much. So today, let's begin with the anxiety, insomnia, and medical cannabis. Why I have chosen this topic is number one, because I have done my post-graduation in generalized anxiety disorders. I have invested 3 years of my postgrad in developing a complete Ayurvedic scale of anxiety, as well as we had used Hamilton anxiety rating scale, which is a universally recognized scale for diagnosing anxiety patients. And moreover, not just theoretical, but actually in practical life also, we see that today, almost I would say that 70 to 75% patients, it's an alarming rate, which I see in my clinic, and I'm sure most of the doctors have been seeing post-COVID, are facing either mild, moderate, or severe levels of anxiety. And as Ayurveda practitioners, we need to fix this because we have a holistic approach towards health, which is not just physical, but mental, spiritual, and social aspect. Everything has to be taken into consideration. And I would be happy to say that a few months ago, I was introduced to cannabis practice, and I actually was very curious to know about what it is all and what is the world doing in the field of cannabis. And surprisingly, so many good companies like Ananta Hemp has also been doing a lot of research in their products, and it has been wonderful using all these products in my practice. And I have seen some very encouraging results, which I've shared previously with other doctors as well. So let's begin with today's topic, and that is about cannabis. So what is the reference? Why I'm talking about medical cannabis today is because as an Ayurveda practitioner and also as a Dravya Guna postgrad, cannabis is something which has always been in existence in Ayurveda, and the reference goes back to Ananda Kanda, which is a Rasa Shastra textbook, and also to so many samhitas like Sharanghar Samhita, Rasa Tarangini, Bhav Prakash, Amar Kosh, etc. And we are not so eager or curious to know about this drug because of so many legal aspects which were involved in it. Plus, the availability of the products was always a challenge. But now with medical cannabis as a worldwide practice, I think this is something which is very much important for us to include in our practice, and it has given a new angle to our practice as an Ayurveda practitioner. The medical, in the Granthas, out of the first 5 important plants which were mentioned in Atharva Veda, one of them is Vijaya, that is what we know as Bhang or what we know as cannabis sativa ling, and the others being some like Tulsi, etc. Now, this is currently placed under Schedule 1 in United Nations Convention on Psychotropic Substances. In India, it is considered under Schedule E1 because some of its part is also under the narcotics. But today we are going to primarily talk about its useful pratyanga, which is nothing but the leaf and seed, which is being used as medicine. It has originated, or it is called as a part of Amrita. We know that Amrit means elixir or nectar. Okay, so that is the importance of cannabis. And in Ayurveda, the shodhan of bhang is very, very important. It has been mentioned that it needs to be detoxified. And the Shodhan has to be done in cow milk or cow ghee so that it can be directly used in medicine or for medicinal purposes. I'm giving a bit of background of medical cannabis because its reference has originated in Ayurveda, and as Ayurveda practitioners, we are legally allowed to practice cannabis. So we should be also knowing the Granthokta Gunadharma of cannabis. It has Ushna Virya, it is Tikshna, it is Vyavayi. Vyavayi is that bioavailability even before digestion. This is one of the most important aspect of cannabis, which I think makes it more effective in even in formulations. And Yogavahi, that is its synergistic action, which is the need of the time. Its bioavailability and efficacy is extremely high. It has been mentioned in more than 50 diseases. So you can imagine the wide application, therapeutic application of cannabis in practice. Traditionally, bhanga, which is the weakest. So we know bhang, we know charas, and we know ganja. But let's understand the difference between it. Bhang is the weakest, which is used even during Holi, So it is made from leaves. Ganja is made from flowers, and charas is the resin that covers female flowers and is strongest. The reference of morphology, specifically how a Vijaya plant looks like, is being mentioned only and only in Ananda Kanda, which is a Rasa Shastra textbook. Other references have been in other samhitas, like I mentioned before. Now, the synonyms here are very important because when we study any Ayurvedic drug, we have to know what are the synonyms, what it has medical application in our practice. So few of it I would like to see talk about, and the rest you can see on the screen. Like Vijaya, why is it called Vijaya? Because it gives us victory from 6 desires of mind. Now, the underlying meaning here is that it has good control over our indriyas, our senses, and our mind. It is called Bhangi, that is, it treats Tapatraya, the 3 basic types of diseases. Then it is also called Ganja because of its intoxication-like effect. Vimardini because it can be processed by compounding only, it's pounded and then only it can be used in medicines. Now the word Divya because it causes exhilaration or pleasure. So I would say the happy hormones are something which can be effectively given by the usage of this cannabis. See, Siddha because itself it's a holy herb. And you can see some other, so I'll just quickly run through it, that Pashu Pasha Vinashini, that is restores health from non-human behavior. I found this very exciting here, the meaning, because when we see nowadays the different levels of anxiety and also stress, depression, we see that there is a kind of non-human behavior also, like people get little more violent, there is rage. And in this also definitely Vijaya has given us extremely good results. So this is something which is more exciting to know about. And Kalagni, which provides victory from death. Sarva Rogagni cures all diseases. Then let's see the properties which I've already discussed. It is Tikta, Katu, Laghu, Ushna and Katu. It is slightly Pittakara, Vata and Kafahara. And the actions which are important here to understand, because this gives us an idea how it can be used in various diseases. It is Grahi, Pachana, Deepana, Kamada, Vajikarana, Tandra, Murcha, Moha, Nidra Janana, Karshini, Vyavayi, Medhya, Vak Vardini, Mada, Sukham, Sattva, Yogavahi and Rasayan. So these are the important aspects which are going to give us a good understanding of how Ayurveda has also explained this so many years ago, around 5,000 years ago, this knowledge was still existent. Shodhan has to be done before using Vijaya. In traditional Ayurvedic preparations like Kameshwar Modak, Bilvadi Churna or Jatadi Churna, or in Trailokya Vijayavati, the Shodhan process has been mentioned in cow milk and cow ghee. And I found one of the references which says that the Shodhan process helps to reduce the THC by 85%. Now, I'll be talking about what THC is exactly, but this is something very important, that the negative effects can be decreased with the help of proper Shodhan procedure. This is just a photograph of hemp. The Indian variety is around 2 meters in length, and these are the hemp seeds which are also available as nutritional products with various companies like Ananta hemp, the pod here. Now let's study about what cannabis is according to the modern pharmacology. In our body, there is a human endocannabinoid system. And in our body, if you can see here, I don't know whether my cursor is moving and it can be seen on the screen. Vikram, is it visible?
No, ma'am, the cursor is not.
Okay, fine. So I'll just point out. You can see on the screen in the human body, there is a CB1 and CB2. These are the receptors. They are the cannabinoid receptor 1 and cannabinoid receptor 2. They are distributed in various places in the body. Like CB1, you primarily found in the primarily found in the brain and in the nervous tissue, and CB2 is in most part of the body and is related to immunity, gut, the reproductive system, etc. So you can see various receptors like this are present all over the body, and then there is something called as phytocannabinoids. So phytocannabinoids is available in the hemp, the cannabis variety, and these phytocannabinoids like THC and CBD, CBN. So these are the phytocannabinoids which are actually helpful in which combine or which enter into a lock and key mechanism with the endocannabinoid system, with the receptors just now, which I spoke about, the CB1 and CB2 receptors. This is little technical, but it is good to understand because this is something based upon which the action of the drug differs. So the THC and the CBD, they combine with they act on the receptors of CB1, CB2 in the body, and also they help in releasing neurotransmitters through the neuron in the neuronal pathways, and they help in combating inflammation and various pain factors in the body, also help in immunomodulation. So this is a beautiful thing which is to be understood before the use of medical cannabis. You can see here in the photograph, it's clearly seen how cannabinoids works in the body. So there is this neuron, it's a presynaptic neuron, and through this, when the phytocannabinoids, they get into the lock and key mechanism with the endocannabinoid receptors, then they secrete the neurotransmitters here are in action, and the message kind of transmits from one neuron to the other neuron. And this is how it will act on the body and help in pain relief and in various inflammations, various disorders where pain, inflammation, or immunomodulation needs to be done. This is a little bit more detail. I won't go into much detail, but you can see where the receptors are. It's already clearly mentioned. CB1 receptor in the body, what it deals with or what are its target. It's motor activity, thinking, motor coordination, appetite, short-term memory, pain perception, and immunity, like I just mentioned. And the CB2 receptors, they are present in the gut, kidneys, pancreas, adipose tissue, skeletal muscle, bone, eye, tumors, reproductive system, immune system, respiratory tract, skin, central nervous system, cardiovascular system, and liver. Why is it important to understand where these receptors are, so that even if you correlate the Ayurvedic reference, you will see that the Acharyas definitely knew where the action of cannabis would exactly be, and even modern science has confirmed the exact same places. So if you see Grahani, we can say, the intestines, or if you see other diseases which have been mentioned, skin diseases, everything has been covered in this. So we should know where the CB1 and CB2 receptors are present in the body, so that accordingly we can use cannabis for all the diseases which are related to these receptors in the body. There is also a challenge which even I had initially was, which I think all the new doctors would be having, is because it's a cannabis derived product. So is it going to create any psychotic effect on the patient? Is it going to, cause dependency, or is it going to cause any kind of things like drowsiness, dullness, etc., or something like people get addiction. So is there all these kind of challenges here as well? So first important thing to understand is that we are using leaves and seeds here, which are the upyukta anga of the plant. So the part which actually causes all the other dependency and addiction kind of effect is more present in the flowers and the resins. But since we are restricting our usage to the seeds and the leaves, it is very much safe to use. And also it depends on the cannabinoid guide. If you can see which phytocannabinoids are actually causing non-psychoactive effect. Here, the CBD, you can see the full form. One sec. Yeah. So there is cannabinol, CBD, cannabinogenol, and cannabichromine. So these are a little more into details. What we need to understand is how these are acting on the body. They are non-psychoactive. And the other one, which is most talked about, or people are generally worried about, is the THC, CBN, and THCV. So if they are a little higher in proportions, then they can cause such effects. But in the for medicinal purpose, we can definitely very safely use these drugs. Now you can see I've given a comparison here about the endocannabinoid system. The disorders CBD assists with, just now we saw what CBD is, and where and which disorders it can be useful in. And at the same time, I put here a comparison, complete list of the diseases mentioned in Ayurveda. So we can correlate that all these diseases, there are around a list of 50 diseases where we can use cannabis. So even if your diagnosis is based on Ayurvedic parameters, we can definitely use cannabis. And also disorders, according to modern diagnosis, you can see the entire list. Today, conditions like migraine, multiple sclerosis, fibromyalgia, depression, epilepsy, breast cancer, diabetes, menstrual cramps, RA, Alzheimer's, glioblastoma, Parkinsonism, and ALS, PTSD, asthma, hypertension, Crohn's disease, IBS, testicular cancer, prostate cancer, and osteoporosis. And I would like to mention here that I have tried and tested this medicine, most of these conditions, though not all yet, but I'm definitely looking forward to cover all these topics soon, or in all these diseases soon, and find my own research-based data here. You can also browse through the entire list, what has been given, and through most of the systems and chronic and critical illnesses also, we can use cannabis safely. Now let's begin with the cases. Since I mentioned that my topic of interest was generalized anxiety disorders, and we have been diagnosing the patient based upon two aspects. One is the Hamilton Anxiety Rating Scale, which is a global scale, and the second one, which I had designed, or I had made during my postgrad study, was the Ayurvedic self-assessment scale about Chinta or Chittodveg, which can be compared to anxiety disorders. The topic of my dissertation was comparative evaluation of Medhya effects of Ashwagandha and Shatavari in the management of generalized anxiety disorders. So this is, now what is generalized anxiety disorder and why I'm talking about it? Because this is a group of disorder. It's like a syndrome to mention, where it is characterized by excessive or unrealistic anxiety about two or more aspects of life. And I'm sure as practitioners, we are dealing with these in the current era, not just adults, but also in children, we are finding anxiety, which is a sad thing to say, but definitely most of the symptoms, if out of interest, if anybody just picks up Hamilton rating scale, I do have the scale with me here. So this is the complete assessment, which we used to do for every patient. So there is a list of 108 symptoms. And this entire thing comes under generalized anxiety disorder. So we do understand that palpitations or anxious feelings or thoughts could be anxiety, but you would be surprised to know that sometimes just stiffness or a grinding of teeth or loss of interest or something like fainting feeling, it could also be something under generalized anxiety disorder. So it is not just that, of course, we need to evaluate it well, understand the patient in detail, but this is a list which makes us understand that a whooping list of 108 symptoms is something which is called as generalized anxiety disorder, the most understated or most ignored part of the diagnosis. And if you actually go and have time to in detail to access any patient's history, you will find that literally 75 to 80% of the people fall under this category. And I would say even urge the doctors to do a personal evaluation here to find out whether even we come under this category. So let's start with the cases. This is my personal experience, which I have seen in my patients what improvements. So I'm going to discuss few cases here. So case one, this is a female aged 41 years and she had history of hypertension and insomnia. When she came to me, she was on 0.5 mg petrol and a lot of anxiety. So you can see the symptoms were anxiety about working in kitchen. Going to the kitchen and start working, that was also creating a lot of anxiety. Post-COVID fear of death and diseases. She herself had faced COVID. Palpitation more when at rest, body ache, constipation, unwanted thoughts in mind, persistent worry, problem of focusing in any work. So this was actually a bit challenging for her because her children were school-going kids, and she's finding it very difficult to cope up. And with in-laws in the house, it's becoming difficult to manage work as well. Nadi was Pitta Pradhan. If you go with the Ashtavid Parikshan, for first case I have mentioned in big detail. So Mutra Samyak, Mala Vibandha was there, slight constipation. Jibha Sam, Shabda Prakrit, Sparsha Mrudu, and Prakriti was Pitta Vatanubandhi. So here I would like to focus that she had Pitta Pradhan Prakriti. Menses regular, but slightly there was little more bleeding. And BP, like I mentioned, she's hypertensive, so it was on the higher range. The lab investigation showed prolactin raised, and her diagnosis as per Ayurveda is Chittodveg or generalized anxiety disorder. Now going with the treatment protocol, the Ayurvedic medicines were started as per Ayurvedic Nidan, and I would just like to quickly show Chandraprabha, Shatavari, Ashwagandha, Kamdudha, Pravalpishti, and Avipattikar. We started her with Pratimarsha Nasya, 3 drops of Panchendriya Vardhan oil daily, which she was doing on her own. And medical cannabis tincture was started as adjuvant therapy. The dose given was 4 drops sublingual after dinner, 1 hour before bedtime. The ratio was 1000 milligram cannabinoids in 10 ml. Ananta hemp has this combination with them. I was using the same combination. It contains Vijaya leaf extract 10%, hemp seed oil 85%. So this is very important that it has the leaf extract and the combination is clearly mentioned here. The carrier oil is hemp seed oil, so which is dual benefit because it's the same plant being used in both. We also did mindfulness meditation session for her because these patients need counseling as well, and I conduct mindfulness meditation exercises in clinic for the patient. Pranayam, Yog Nidra was advised, 6 steps meditation was advised to patient. The dose was started on 24th April 2022. 10th May when the patient came, her follow-up was improvement in sleep, unwanted thoughts had reduced, palpitations had reduced, but focus was still not there. Patient generally was feeling better. 10th to 20th May follow-up, I usually call the patient after 15 days. So I have complete idea about how they are doing. The sleep pattern improved, fear about unwanted things improved, and willingness to work improved. We also taught her a bit of things to do so that now she has found a new, her own interest in her work. Previously, she was not even knowing that what she would be passionate about, what she wants to do in her life. On Hamilton Anxiety Rating Scale, parameters like below had improved. I have just given a gist of it, not the entire symptom list, but you can see the anxious mood before treatment is 3, the score was 3, after treatment 1. Tension before treatment 2, after treatment the score had reduced to 1. Fear before treatment 3, after treatment 2. And still the treatment is going on. GI symptoms 3, and after this it had reduced to 2. Moving further, so this is my experience. All these patients which I have mentioned here are still undergoing treatment with us. So they are much better now, but we would like to get, completely stop their modern medication as well. The next case is of a male, 45 years. This is a very interesting case because this I felt like a breakthrough here. Present symptoms of the patient are dizziness, lethargy, low energy, anxiety before addressing meetings, disturbed sleep, threatened feeling of, the office mates, colleagues, doesn't like anyone challenging his point of view. He was in corporate lifestyle, worried about career and people's behavior in office in the past, and likes perfectionism. So I think even this at times take toll of mental health. Trauma after father's heart attack in 1998. The modern medicine which he was on, 10 mg benzodiazepine since 20 years. And the reason why he approached me was he wanted to stop it completely with Ayurvedic treatment. Now this was a bit of challenge because his expectation was too high. I had clearly told her that we'll surely try, but you're in a considerable high dose for last 20 years. He has done Virechan and Nasya in December 2021 in Kerala, and he had come to me after that. The mala was irregular, sometimes constipated. Again, diagnosis chittodvek and severe anxiety. Treatment given to him based on Ayurvedic principles, Tagar, Brahmi, Jatamasi, Surasa, Kapikachu, Ashwagandha, Kamdudha and Raktapachak. Pratimarshanasya, 3 drops of Panchendriya Vardhan oil. Medical cannabis was started as adjuvant therapy in the dose of 4 drops sublingually after dinner, 1 hour before bedtime. We had advised him lifestyle changes like pranayam, yoga nidra, and 3 sessions of access therapy because I'm also an access practitioner, and it was done for complete relief. And when the patient had come, like I mentioned, he had severe anxiety. The best part was, which is coming further, in the treatment protocol, you see the treatment was started on 15th April 2022 till 4th May or 2022. The patient managed to reduce benzodiazepine dose from 10 to 5 mg. Now, it was a big leap. I had told him to go gradually slow about it, but he was finding very good effects of the medicine and he was ready to take that next step. Anxiety had reduced with medicines and counseling, and lethargy had reduced, but because he was in the transition and he was going into dose withdrawal, there was headaches. He had some intense headache episodes and low energy was still there. So I had introduced Kamdudha, 2 tablets for frequent headache, especially. He used to have it after Divaswa, that is sleeping during daytime, and headaches had got better after starting Kamdudha. From 4th to 23rd May, patient was determined for further reduction of dosages and he was feeling better. So he reduced benzodiazepine gradually to 2.5 mg. But he was a well-built Kashmiri person, and 2.5 mg is like a placebo, had a placebo effect on him. So I was telling him that this dose is, just consider it as a placebo effect. But he did have dizziness and headache sometimes still. So meanwhile, cannabis and other Ayurvedic medicines continued. So 23 May to current date, you can see patient's follow-up message. This is a WhatsApp message which has sent to me. This is day before that, hey doctor, I'm doing well, managing the transition from benzo. It's 3 weeks now, and I'll post my comments on feedback on clinic profile. Thanks. This is something really good because he has stopped his benzodiazepine and he's completely managed to do without it for 3 weeks, which is a great thing because the expectation which he had from Ayurveda could be fulfilled because of the combination of Ayurvedic medicines and cannabis. Now, patient is currently doing very well. Anxiety before meetings has completely gone. Focus in work has improved and headache, dizziness, energy levels are much better. He hasn't complained about headaches either. Moving towards case 3. Male age 43 years. Now this is referred by the previous patient because he found good results. So he sent his brother-in-law. The relation between both, they're both brother-in-laws. His current symptoms are irritation, mood swings, lack of appetite, lack of sleep, sweating in palms, concern about family members. He was about to quit his job. He is working in one of the renowned car industry. He was not happy with his monotonous job in a car company. Work-related anxiety, Monday blues, and never has feeling of hunger. So he told me this specifically that I'm never excited about eating food, never feel hungry. And always there was anxiety even about simple things like kids' homework and their being outside. He used to wake up at 2:30 a.m. and couldn't sleep again. And he was taking sleeping pills, Zolfresh 10 mg, and he was on antidepressants and constipation when he came to me. History of fissures, and Prakriti was Pitta Pradhan Vatanubandhi. So you can see the treatment protocol here. Kamdudha, Jatamasi, Brahmi, Nakeshar, Ashwagandha, Arogyavardhini, Aragvad and Shatavari. Pratimarsha Nasya we start for each and every patient because Nasya has extremely good results. Pranayam, left nostril breathing, mindfulness meditation exercises were started, and I always give them some activity like doing gratitude journal and noting down anxiety triggers. So I tell them to make a journal and write down their triggers because when we know what triggers, we can actually advise very nicely and counsel the patients, and it helps a lot in improving their anxiety levels. Medical cannabis was started as adjuvant therapy at night. Here, just a different combination was used, but the dose was 4 drops initially at night, 1 hour before bedtime. After sensitization for a week. What do I mean by sensitization is like when we start cannabis, we have to initially go with a low dose, as because if in a patient who has never been introduced to cannabis before, slowly the patient's body has to be sensitized to cannabis, and after a week dose, we can increase it to BD. Okay, the combination is 3000 mg cannabis leaf extract in 10 ml. Treatment was started on April 23rd, and the first follow-up I got was on 9th May. Patient saw improvement in sleep, although he was still continuing his sleeping pills. He was bit scared to stop them. Already I had advised him to stop that. And antidepressants are still there. His focus and energy levels had improved, and anxiety related to kids and family health, financial concerns had reduced. In fact, he had so much of anxiety that he had kept his parents away from his house because he thought that his wife would be overburdened by him, his two kids, and his in-laws. And she was working as well. So he told me specifically that I feel very bad that I have to keep my parents at my brother-in-law's house. But then you can see the next follow-up was on 2nd June. He had taken medicines used to carry for mostly 3 weeks along with him. By this time, I did not get a feedback on phone or anything. Then he came and met me again on 2nd June. Patient had stopped his sleeping pills completely by himself, and he was getting good sleep. So this I would definitely give the credit to the cannabis dose. And all his symptoms had started improving. He had left his job previously and was unable to focus on new job. But after the above treatment protocol, his zeal to work has come back. And this, according to me, is something very, very substantial. Because if a person who is in this age group has to take care of his family's financial needs, everything, with school going children, he has to be in the same state of mind. Also, the best part was that he could get his parents back, and he was pretty happy about it. Then after that, he got his wife also for treatment. Case 4 is about this is a case which is 42-year male, insomnia and depression. Now his insomnia was extremely worse because he was on allopathic anxiolytics and antidepressants and sleep medication for a prolonged period. But he was referred to me by a psychiatric friend of mine, and he had approached us at Ayurveda first to treat him for anxiety, insomnia, restlessness, lack of focus, energy, unwanted thoughts, and continuous anxious feelings regarding work and career. He had stopped taking allopathic medicines when he approached us, but was suffering. He had stopped it actually much before because he really did not find it much effective and was having a lot of side effects. So he wanted to get treated by Ayurvedic treatment protocols, but he was suffering from severe anxiety and insomnia and acidity. He could not actually sleep for more than 3 to 4 hours at night. Prakriti Pitta Pradhan Kapanubandhi. Since the severity of symptoms were more, patient was advised Virechan. We got everything done for him, Virechana, Abhyanga, Shirodhara, Nasya, and it helped him pretty much. Daily Yog Nidra, Pranayam, counseling, a lot of counseling had to be done. Access therapy sessions were conducted for him as well. Mindfulness meditation conducted in clinic, and reading spiritual texts was also advised. Because sometimes all these things help a lot. Because he used to ask me, doctor, what if I get up at 2 o'clock? Usually he used to get up at 1 o'clock at night, and he used to stay awake till 4:30. So he didn't know what to do during that time. So for people, I usually advise that don't go back to your gadgets, and please follow sleep hygiene, which means being away from gadgets, and just depend more upon reading something which really makes you inspired or feels whatever it can be, but not anything like thrillers or adventures or anything which makes you excited. So spiritual text was something he was inclined to, and we did have a good discussion on it, and he started doing that. The medical cannabis oral tincture started again with 4 drops and then increased to 5 drops sublingually. Cannabis leaf extract 3000 mg per 10 ml was the dose given to him. First month, sleep pattern improved considerably. Patient woke up in between but was able to fall asleep again. His energy levels had increased and he started walking up to 7 to 8 kilometers daily. So he was very happy when he came to me and he told me that, doctor, now I can at least sleep and I don't feel that hangover kind of thing in the morning. My day starts with a good note. In between, he again slides into anxiety. He slided into anxiety because unfortunately he lost his father 2 months ago. During that time, he had a lot of anxiety due to personal issues, and he felt the guilt of not meeting his father before his death. And but he has recovered well now. Again, we conducted some mindfulness meditation for him. On and off, his symptoms of anxiety, lack of focus, lethargy, they were coming up, but they keep on happening. But he's still undergoing treatment, and now he's really doing well. I would say it's almost 4 months. Apart from the episode of his father's death, he had been constantly doing well. He has got back to his work. He's an engineer, so his focus in work has come back. There is no lethargy, drowsiness now, and he feels much more energetic. Patient's Google review. I am fully contented about consultation and medication. There is a 5 to 6 lines review. I've just picked up one line to mention about his understanding. So thank you. This is all from my side. I hope I was able to give my little bit contribution about cannabis practice, and I would like to know if anybody has any questions. Thank you.
Yes, ma'am. Thank you so much for sharing your opinion. I'll just mute yourself.
Yes.
Thank you so much, ma'am. I think it was a great collection of knowledge, and the case studies which you presented, even it's an eye opener for me also. And when we hear about these cases, जब ऐसे cases पता लगते हैं और ये medicine उसके अंदर कितना effect कर रही है, it is very good to hear, and this is the reason why we actually this is the reason why we were convinced about this medicine so much, because ये इतने multi dimensions में काम करती है, जैसे आपने endocannabinoid system समझाया, जो कि हमारे बहुत सारे बॉडीली फंक्शंस को बहुत तरीके से मैनेज करता है. तो अगर हम लोग अपने जो ह्यूमंस अंदर एंडोकैनाबिनॉइड्स प्रोड्यूस करते हैं, जब वो कम पड़ जाते हैं और ये जो मेडिसिन उसको ओवरलोड देता है या लोडिंग देती है, उससे ये सिस्टम बैलेंस के अंदर आता है. ये मेरी एक बेसिक अंडरस्टैंडिंग है. एंड उसके बाद आपने जैसे केस स्टडीज बताई, उसके अंदर जो मेरी अंडरस्टैंडिंग कहती है, मैम प्लीज करेक्ट मी इफ आई एम रॉन्ग, बट मेरी अंडरस्टैंडिंग ये कहती है कि जो ये मेडिसिन है, जो आप ये बाकी जब ट्रीटमेंट देते हैं किसी को, उनके अंदर आप 3 मेडिसिन यूज कर रहे हैं, 4 मेडिसिन यूज कर रहे हैं, विद ऑब्वियसली ऑल दी अदर मेडिटेशंस एंड एवरीथिंग व्हिच यू डू, कैनबिस एक्चुअली एक्ट्स लाइक अ कैटलिस्ट, एंड इट एक्चुअली इम्प्रूव्स, वो इम्प्रूव कर देता है बाकी के सिस्टम को भी. तो जो आपकी नॉर्मल मेडिकेशंस भी हैं, उनका भी इफेक्ट बढ़ जाता है. प्लस वो जो हमारे एंडोकैनाबिनॉइड सिस्टम को जाके एक्टिवेट करता है और उसके जो फायदे होते हैं वो हमें अलग से मिलते हैं. सो दिस इज समथिंग आई थिंक दैट इज herb works, and we are still exploring कि कहाँ पे काम कर सकता है और क्या कर सकता है. I'm sure कि अगले 2-3-4 साल के अंदर, 5 साल के अंदर इसके ऊपर इतनी रिसर्च होगी and इतने चीजें इसके अंदर से निकल के आएंगी. इनफैक्ट इवन द वेस्टर्न स्टडीज, इवन दे आर एक्सप्लोरिंग राइट नाउ. इट्स बीन यूज्ड. अभी हमें यहाँ पर अभी फ्लावर और बड यूज करना अलाउड नहीं है, हमें यहाँ पे सिर्फ लीव्स यूज करना अलाउड है. लेकिन वी विल सी अ टाइम वेयर मेडिकल कैनबिस विल बी एबल टू अलाउ टू यूज दैट, एंड देन वी कैन एक्चुअली स्टार्ट ट्रीटिंग लाइक मेजर इलनेसेस. हमने बहुत जगह वेस्टर्न इंस्टीट्यूट्स में देखा है कि लाइक प्रॉब्लम्स लाइक कैंसर एंड प्रॉब्लम्स लाइक ऑटिज्म एंड एपिलेप्सी एंड ऑल दीज सीरियस कैनबिस हैज अ वेरी वेरी पॉजिटिव रिजल्ट, बट हमें अपनी स्टडीज करनी बहुत जरूरी है. So, ma'am, it was great that you have collated the information, and I hope the doctors who have joined us today will get good knowledge from it. Diveshji, I would like to ask if there are questions, we can put them up. And
okay, one thing, Vikram, before we proceed to the Q&A, I kept myself restricted to today's topic about anxiety and insomnia, but let me tell you that in my clinic, I've been using it for pain relief and have found some extremely encouraging results. That's where it got me hooked on to cannabis practice, because pain was a challenge. And like in my introduction, you have mentioned insta pain management. So we do certain panchakarma techniques like Agni Karma, Vidya Karma for insta pain management. But अगर उसके साथ हम कोई और मेडिसिन नहीं देते हैं और ओनली अगर हम कैनबिस देते हैं, which I've done actually, that हमने कोई और मेडिसिन नहीं दी, सिर्फ कैनबिस आपके जो अनंता हेम के PRC कैप्सूल्स है वो मैंने यूज किए, एंड इट वाज जस्ट दैट ओके, देखते क्या होता है इससे. दैट वाज माय काइंड ऑफ एटीट्यूड कि चलो देखते हैं, लेट अस टेस्ट. And the patient just called me and told me कि doctor, what did you give? Initially I was thinking कि ऐसे क्यों पूछ रहा है. So he told me कि this was a guy who is 40-year-old and he was suffering from cervical spondylitis since last 20 years. An engineer, and he just took it. He had come for his mother's treatment, and then when he came back, he told me कि मुझे दर्द है, so we had given. After 2 days he called me and he said that you gave me something, I don't know what it is, लेकिन वो मुझे बहुत अच्छा लगा, क्योंकि फर्स्ट टाइम मेरी जिंदगी में मुझे पेन नहीं हुआ. मैं पेन किलर लेता हूँ फिर भी मुझे इतना फायदा नहीं हुआ और मैं अच्छे से सो सका, पेन फ्री मुझे नींद आई. So he is in real of the medicine, and then I found that I used it in multiple cases of RA. I have a lot of patients of frozen shoulder, diabetic frozen shoulders है, RA के cases आते हैं हमारे पास, या severe lower back ache. तो इन सब में मैंने PRC यूज करना शुरू किया, एंड इन्फ्लेमेशन में और पेन में इसका बहुत अच्छा इफेक्ट है. एंड लाइक यू राइटली मेंशन कि इसका हमने शुरुआत में ही जो डिस्क्रिप्शन देखा है कि वेवाई और इसका जो गुण है वो सबसे इम्पोर्टेंट है, द सिनर्जिस्टिक एक्शन एंड इट मेक्स इट इम्प्रूव्स द बायो अवेलेबिलिटी। तो ये बहुत इंपॉर्टेंट एस्पेक्ट है इस मेडिसिन के, जो हमें बाकी मेडिसिन के साथ तो इफेक्ट देता ही है। And I'm using it currently for menstrual cramps. I'm using it in fibromyalgia. These are the other cases which I hope in future presentations I would able to present my case. I would be able to do that. Fibromyalgia में मुझे इसके अच्छे results मिल रहे हैं। menstrual cramping जो severe endometriosis में है उसमें हमें अच्छे results दिखाई दे रहे हैं। उसके बाद मैंने अभी epilepsy में currently start किया है। It's in my own family and I would be going to go in a detailed history because I want to really work out epilepsy के साथ depression भी है, तो I want to really try out and see how the oral tinctures work on this. So it will be my own research to do.
Yes,
So
ma'am.
thank you.
कंप्लीटली अंडरस्टैंड इस मेडिसिन के अभी जो हमें मैक्सिमम बेनिफिट्स नजर आए हैं वो ऑल टाइप ऑफ पेन मैनेजमेंट एंड ऑल टाइप्स ऑफ लाइफस्टाइल डिसऑर्डर्स, ये दो मेन एरियाज हैं जिसके अंदर ये मेडिसिन डेफिनेटली बहुत अच्छा काम कर रही है। And doctors like you are trying it in different areas, and we are also getting more knowledge about that, and we are also getting more this thing. So I hope, and we are in a process of doing clinical trials also, ma'am, and also with doctors like you, we're also trying to create a database of research and case studies. Where doctors themselves are coming out, and जैसे आपने case study present करी, तो we going to be collating all this information कि कल को मतलब in some time we'll be able to provide doctors with so much of information on this। किसी आप case studies देख सकते हैं, आप research देख सकते हैं, आप clinical trials देख सकते हैं, आप CMEs हमारी देख सकते हैं। तो इससे this is where the idea is, because doctors to the knowledge, because you as a doctor you have very analytical minds। तो जब तक आपको इन्फॉर्मेशन ना मिले, जब तक आपको कन्विंस ना करा जाए, आपको मतलब तरीके से फार्माकोलॉजी ना समझाई जाए मेडिसिन की, तो यू विल नेवर बी कन्विंस कि हाँ ये मेडिसिन कैसे काम करेगी। कोई बिल्कुल ब्लाइंडेड तरीके से इसको यूज नहीं कर पाता है, फिर डोजेज इज अ इशू, अंडरस्टैंडिंग द पेशेंट्स प्रॉब्लम इज एन इशू। सो आई अंडरस्टैंड दैट, and that is the vision of Ananta also, man, that we create so much of data on this plant and this medicine that it becomes a no brainer and a no question for any doctor to say कि नहीं यार ये तो पता नहीं काम करेगा कि नहीं करेगा, which is, and plus the taboo will obviously go off with time, because अब food, जैसे हमने seed का बात करा, seed has been accepted by the FSSAI now, so in the next 1 year you will see so much of hemp food in the market that you will be able to find them on general stores, kids will be eating it because it's a nutritional item। So that perception will change. Similarly, we have a target of changing the perception within the doctor community and the patient community about this medicine, and it should be like one of the main streamlined medicines which should be used for so many cases. So that's exactly what we are trying to do, ma'am, and we are very very grateful for the support of doctors like yourself, because it's a hand in hand situation for you and for us also, and I hope that we are able to do some good work and help the patients out.
Definitely.
Yes, ma'am. Let's take the questions from Devesh ji and then we can proceed. Devesh ji?
Yes, sir.
आपके chat box में questions आए हुए होंगे तो आप please share कर दीजिए।
Yes, you can see on screen.
Ma'am, there's a question from what's the difference between herbal and PPAM?
कमल जी, आई थिंक आपने पहले भी कोई क्वेश्चन पूछा है। ओके, कैन यू एक्चुअली टेल मी व्हाट PPAM इज, बिकॉज आई एम नॉट अवेयर ऑफ दिस टर्म।
Okay. Devesh, we can move to the next question and then come back.
Sorry, the question has moved away very fast. I'm not able to see it on the screen.
There is no any question.
Okay.
Okay, thank you.
Either the audience has understood everything या कुछ नहीं समझ में आया। In that scenario, I think.
Thank you, ma'am. There is no any question right now.
Okay.
क्या कह रहे थे Devesh जी?
अभी कोई क्वेश्चन नहीं है सर।
नहीं आ रहे, ठीक है मैम। वन क्वेश्चन आई वांटेड टू आस्क यू, व्हिच आई हैव बीन फेसिंग विद लॉट ऑफ पेशेंट्स, दे कम एंड इंक्वायर टू अस आल्सो, and this is something which I think as a doctor you must be also facing. When they start the medical cannabis, especially in disorders like stress and anxiety, तो ये आप कैसे जज करते हो कि उसको कितना लंबा डोज देना है, एंड उसके बाद हाउ डू यू ब्रिंग हिम आउट, बिकॉज दे हैव अ प्रॉब्लम कि ठीक है वी अंडरस्टैंड कि इससे एडिक्शन नहीं होता, लेकिन पेशेंट के दिमाग में रहता है दैट ही इज टेकिंग cannabis.
Yeah.
So in a case of an anxiety disorder or a stress disorder, how do you decide the dose and how long it should be given?
Sure, this is a good question, Vikram. Two things, like I mentioned, if you're going, see, one is qualitative assessment and one is how the patient is doing clinically. जब हम कोई भी एंजाइटी स्ट्रेस वाले पेशेंट या उससे ज़्यादा सीवियर एंजाइटी में कोई पेशेंट हमारे पास आता है, तो एक तो उसका पर्सनल फॉलोअप, क्योंकि कई बार जब हम स्टार्ट करते हैं ट्रीटमेंट तो घर वाले भी बहुत कुछ बताते हैं कि हाउ द पेशेंट इज बिहेविंग इन ओवरऑल सेंस। कभी कभी पेशेंट भी नहीं बताता, अगर वो कपल की तरह आ रहे, जनरली वो अकेले नहीं आते हैं, तो वो अगर अपने रिलेटिव्स को साथ ला रहे हैं तो हमें कंप्लीट डिटेल हिस्ट्री उसके सोशल बिहेवियर की भी मिलती है, उसके फिजिकल इश्यूज की भी मिलती है। सबसे इम्पोर्टेंट तरीका ये जानने का कि दवाई कब तक देनी है, सबसे फर्स्ट तरीका है फॉलोअप, जो आयुर्वेद में हम उसको उपशय अनुपशय कहते हैं, यानी पेशेंट हाउ इज ही डूइंग ऑन क्लिनिकल पैरामीटर्स। जहाँ पे लैब इन्वेस्टिगेशन जरूरी है वहां पे वो भी हम कर सकते हैं। एंजाइटी के केस में आज ब्लड पैरामीटर्स से कुछ फाइंड आउट करना बहुत मुश्किल है स्ट्रेस एंजाइटी में, लेकिन उसमें काफी सारे साइकेट्रिक स्केल्स है which are very important as an Ayurveda practitioner also to follow. Like अभी मैंने आपको बताया कि एक हैमिल्टन एंजाइटी रेटिंग स्केल फॉर एग्जांपल, ऐसे बहुत से यूनिवर्सली एक्सेप्टेड स्केल्स है। अगर हम उन पैरामीटर्स पे भी काम करेंगे, या जैसे मैंने खुद की एक स्केल आयुर्वेदिक पैरामीटर्स पे डिजाइन की थी, मेरी खुद की स्केल भी अवेलेबल है अगर किसी को चाहिए तो, आयुर्वेदिक पैरामीटर्स ऑन कलेक्शन ऑफ ऑल द सिम्टम्स हमने की थी। तो आप अगर क्वालिटेटिव असेसमेंट भी करें या साथ में हम कोई स्कोर पैटर्न डेवलप करें तो उससे हमें बहुत ज्यादा क्लैरिटी मिलती है, क्योंकि ये सिम्टम्स बहुत वेग होते हैं, हम उसे डिस्क्राइब नहीं कर सकते। तो जब हम स्केल्स यूज करते हैं तो उसके साथ साथ हमें बहुत अच्छे से अंडरस्टैंडिंग हो जाती है कि कोर्स में क्या डिफरेंस आया। और जैसे मैंने इस पे 3 साल काम किया है तो मैंने देखा कि हर 15-15 दिन में हम इसकी असेसमेंट करते थे। उसके बाद हमें पता चल जाता है कि लोगों के साथ हो क्या रहा है। जैसे अभी केसेस में मैंने बताया कि या तो उनके मेडिसिन के डोसेस कम हुए हैं, उनकी स्लीप क्वालिटी इंप्रूव हुई है, ये सब हम फिजिकली जो असेसमेंट है पेशेंट में वो भी करते रहना चाहिए। तो ऐसे जब हम करते जाते हैं हमें कंप्लीट आइडिया आती है कि अब और कितने लंबे तक हमें ये ट्रीटमेंट देनी है। पेशेंट ही खुद बताते रहता है कि नहीं अभी मुझे इसकी जरूरत नहीं। कई 1-2 पेशेंट में मैंने ऐसे किया है कि 1 हफ्ते के लिए मैंने वो डोज बंद कर दिया, even to for me to understand and evaluate कि चल क्या रहा है, and then we restarted, because जो हम कहते हैं कि बॉडी भी थोड़ा सा उसको यूज टू हो जाती है, वो साथ में हो जाता है बॉडी के लिए प्रोसेस करना, बॉडी स्टार्ट्स टेकिंग इट इन दैट डोज देन इट डजंट हेल्प। तो उस तरह भी करना है तो हमने ब्रेक दे के भी किया था, बट मोस्टली मैक्सिमम पेशेंट्स में मैंने कंटिन्यू किया है, क्योंकि जब वो आते हैं तो वो मॉडरेट टू सीवियर स्केल एंजाइटी में ही आते हैं हमारे पास। तो उसको थोड़ा हम उसको अगर ढंग से असेस करते रहे और स्केल्स पर करें तो मुझे लगता है वो सबसे बेस्ट तरीका है असेसमेंट का। एंड देन ऑल्सो टॉक टू देयर रिलेटिव्स, लाइक अगर हस्बैंड को प्रॉब्लम है तो उसके वाइफ से भी आपको पता चलेगा कि वो कैसे बिहेव कर रहा है, उनका चिड़चिड़ापन, बच्चों के साथ का बिहेवियर चेंज हो जाता है, सोशल बिहेवियर चेंज हो जाता है। कई बार पूछने के पहले ही लोग अपने आप ये सब बताना शुरू कर देते हैं, बट अगर नहीं है तो यू कैन आस्क देम लीडिंग क्वेश्चंस, एंड दैट्स द बेस्ट पैरामीटर टू फाइंड आउट कि कितने समय तक हम ट्रीटमेंट दे सकते हैं। So scores and benefit, I would say, using scores like this, universal scales. If tomorrow I want to go and play, present any data anywhere, then these are tools which are very very powerful and effective, because इससे cross questioning नहीं हो सकती। हमने अगर इसमें असेस किया है तो हमारे पास एक प्रॉपर डेटा है जो यूनिवर्सली ऑल ओवर द ग्लोब साइकियाट्रिस्ट यूज कर रहे हैं, साइकोलॉजिस्ट यूज कर रहे हैं, क्लिनिकल रिसर्च में इसका यूसेज हो रहा है। तो मुझे लगता है जो भी हमारे पास ओसीडी के हर इसका स्केल है, अगर आप निम्हांस का डेटा, बैंगलोर में जो निम्हांस है उसका डेटा आप लो उनके पास से, तो उन्होंने भी काफी अच्छी स्केल्स डेवलप की है, तो हम जरूर उस बेसिस पर इसका भी इफेक्ट फाइंड आउट कर सकते हैं। I hope I've answered the question.
I think that's a very good point in case of lifestyle disorders. जो information हमें family members से मिल सकती है वो कई बार पेशेंट भी नहीं बताते होंगे डॉक्टर्स को, या कई बार छुपा जाते होंगे। तो आई थिंक इट्स अ वेरी वेरी गुड आइडिया एंड अ वेरी वेरी this thing to know
तो
the.
हमें ऑल एस्पेक्ट्स पे ध्यान देना है, क्योंकि जब पेशेंट एंजाइटी में वो कई बार या तो वो अपना नोट बना के लाता है, नहीं तो उनके स्पाउस ही उनके सबसे अच्छे हिस्ट्री गिवर्स होते हैं। अगर वो कुछ छुपा भी रहे तो उनके, मैंने देखा है बहुत से बार ड्यूरिंग कंसल्टेशन वाइफ बोलेगी नहीं नहीं आपने ये पॉइंट नहीं बताया, या हस्बैंड वाइफ को बोलेगा नहीं ये भूल गई है। तो आई थिंक दैट हेल्प्स अ लॉट, एंड ऑलवेज बी व्हेनेवर आई आस्क आई टेक फॉलो अप फ्रॉम बोथ इन सच केसेस, so it helps.
We have a question on the screen that how can cannabis be used to treat glaucoma?
Okay, the part Dr. Anmol here is, I have not got any glaucoma cases as of now where I can use cannabis, but you can surely try because the receptors are there. And second thing, I do have a case of diplopia. अभी मैं जिसको treat कर रही हूँ is a brain tumor and diplopia, and definitely I would give my feedback about this in case it helps you. So the only best way to find out is keep reading. If you have not got any cases directly to deal, there are so many platforms where अगर इंडिया में नहीं पब्लिश हुआ है तो बाहर बहुत सारे कंट्रीज है जिन्होंने डेटा पब्लिश कर रखा है कैनबिस के बारे में, आज रिसर्च चल रहा है। काफी लोग इस पे इंडिया में भी काम कर रहे हैं, कैंसर तक में लोगों ने सिंगल हैंडेडली कैनबिस का यूज किया हुआ है और उसके रिजल्ट्स लिए हुए हैं। इफ यू वांट टू एक्सेस द डेटा प्लीज डू फाइंड आउट ऑन वेरियस पब्लिकेशंस, गुड वेब पब्लिकेशंस जहाँ पर हुए, जैसे रिसर्च गेट है, एनआईबी की साइट है, तो आप बहुत इस पे गवर्नमेंट के साइट्स जिस पर है वो सब एक्सेस करके भी आप फाइंड आउट कर सकते हैं। मेरा पर्सनल अभी तक ग्लोकोमा में काम नहीं हुआ है, बट श्योरली इफ आई गेट अ पेशेंट आई विल ट्राई एंड आई डेफिनेटली नो, बट एट द सेम टाइम आई वुड रिकमेंड कि ट्रीट ग्लोकोमा लाइक अ शोथ if you work on Ayurvedic principles। उसमें अगर आप पुनर्नवा गोक्षुर जैसे भी मेडिसिन दोगे तो आपको ग्लोकोमा में रिजल्ट्स आएंगे। उसके साथ आप कैनबिस का व्यवहारिक जो गुणधर्म है उसका यूज करके रिजल्ट्स ले सकते हैं।
And then we have somebody asking what can we tell them about long-term safety. I think they're asking about the medicine long-term.
Definitely, this is a good question. This was my challenge as well when my patient asked me, and I had a talk with Vikram about this, if you remember. जब मैंने second case जिसकी बताई, he is well-learned person, and the moment I gave him this bottle which had cannabis written on it, all alarms went on, you know. So he is asking me कि आपने तो मुझे नशे वाली दवाई दे दी और अब इसका क्या होगा मेरे बॉडी पे, मुझे बेंजोडाइजेपिन को छोड़ना है, फिर कैनबिस से क्या होगा। So I told him little scientific thing, but what I actually told him is like, you know, because लेमैन को दो तरीके से आप समझा सकते हो, एक तो साइंटिफिकली तो उनको बताना ही है, नेवर कीप देम ऑफ एंड डोंट गिव देम you know things which they don't understand. You have to explain on scientific background. But second thing I also told him was कि example आपने देखा है कि poppy seeds हम use करते हैं जो हमारे खाने में होता है। अगर हम poppy seed use करते हैं, आपको पता है वो किस प्लांट से आता है? तो उसने कहा हम नहीं, मुझे नहीं पता। तो मैंने उससे बताया कि अफीम से आता है और आपके घर में है ना? तो बोलता है हाँ हम यूज करते हैं। मैंने कहा आपको कभी नशा हुआ है उससे खाने से? तो बोलता है नहीं। तो मैंने कहा उसी तरह हेम्प का भी है, इसमें हम मैंने उसे बताया कि हेम्प सीड ऑयल, हेम्प सीड्स और विजय लीफ जो है इसमें से सीड तो खाने के इसमें आप यूज ही कर सकते हो, और ये उसी तरह हम उसका वो पार्ट यूज कर रहे हैं जो बिल्कुल सेफ है यूज करने में। लेकिन इसमें भी जो जिस तरह से मेडिसिन बनाई गई है उसको हम धीरे धीरे डोज बढ़ाते हैं और आपको पूरा उसका ये कहते हैं कि डिटेल्स देते हैं कि किस तरह ये आपके बॉडी पर एक्ट करेगी। एंड आफ्टर 1 week when you're comfortable and you see that there are no other adverse effects on your body, will continue the dose. So patient was not at all reluctant. उसे लगा कि ठीक है डॉक्टर मेरी सुन रही है, अगर मुझे कुछ प्रॉब्लम हुआ तो ये मेडिसिन हम रोक सकते हैं। बट उसने खुद ही इसके बाद एक बार भी ऐसे नहीं आया मैं भूल चुकी होगी, लेकिन वो खुद मुझसे बोला है कि डॉक्टर मेरी दवाई खत्म हो गई है। जैसे ही खत्म होती है comes to the clinic and takes the medicine. So now coming back to long-term safety. So all these patients, if you've seen, I started the medication somewhere from March, April abhi tak. And what you can do is assess them on every parameter, you know, Dr. Namrata. आपके पास lab investigation है, go ahead. I would say before starting the medicine, tell your patient to get all the lab investigations done. You can get them on all CBC, LFT, RFT, TFT सब करा लो, because इससे आपको भी फायदा होगा, हमें भी पता चलेगा और पेशेंट को तो होगा ही होगा कि हो क्या रहा है उसकी बॉडी में, उसका एलएफटी सही आ रहा है, उसका लिपिड प्रोफाइल सही आ रहा है, उसकी आरएफटी सही है, टीएफटी सही है, सब कुछ सही है। कीप ऑन असेसिंग एवरी 2 months if you have that concern and let your patient know, because हम जिसको कहते हैं ना कि क्रिस्टल क्लियर होना चाहिए ताकि किसी के भी दिमाग में शक नहीं हो. अगर पेशेंट भी शक के साथ मेडिसिन ले रहा है तो इट इज नॉट गोइंग टू अफेक्ट. ओके, so long term safety as of now in my patients what I have seen is it has not caused any side effects. They were on medicines like benzodiazepine. I have currently started to patient who is an epileptic history. She has for like 30 years now. She's on Valence OD 750 mg and I have started oral tincture for her as well. So I'm going to assess in detail. ये मेरा काम है as a doctor to assess the safety of my to assess the long term safety of my patient. And like I said, best is to take follow up every 15 days. Be in touch with your patient. Don't just leave them. अगर वो आपको call नहीं कर रहा है तो through your channel, through your reception and everything, stay connected to your patient and keep on asking for feedbacks. तो आपको पता चल जाएगा कि क्या चल रहा है. I hope I've answered.
Yes, ma'am. I like to add to this also. जितनी भी हम मेडिसिन यूज कर रहे हैं ये मैक्सिमम जैसे मैंने बताया कि पेन मैनेजमेंट में और लाइफस्टाइल डिसऑर्डर्स के अंदर हम यूज करते हैं. उसके अगेंस्ट जो पेशेंट्स ऑलरेडी मॉडर्न मेडिसिन यूज कर रहा होता है वो जनरली या तो ओपियोइड्स होते हैं जो पेन मैनेजमेंट में यूज होते हैं या फिर वो साइको एक्टिव कंपाउंड्स होते हैं जो कि आपके लाइफस्टाइल डिसऑर्डर में स्ट्रेस के लिए एंटी डिप्रेसेंट्स दिस दैट व्हिच वी आर यूजिंग. उनके लॉन्ग टर्म इफेक्ट्स जो हैं बॉडी के ऊपर वो बहुत ज्यादा नेगेटिव है कंपेयर टू दिस प्लांट बेस्ड मेडिसिन जो कि एक बेसिक बहुत हमारी जो प्लांट है उसका बेसिक एक्सट्रैक्ट है. तो जो मेरी नॉलेज कहती है वो ये भी कहती है कि जो इसका अगर कोई पेशेंट इसको लॉन्ग टर्म यूज करता है वर्सेस द मॉडर्न मेडिसिन व्हिच ही इज यूजिंग फॉर स्लीप डिसऑर्डर और पेन मैनेजमेंट तो उसके बॉडी पे इफेक्ट्स बहुत ज्यादा नेगेटिव है कंपेयर टू दिस मेडिसिन. एंड इसके एज सच कोई साइड इफेक्ट्स है नहीं except like if you just take if you overdose it you'll get a bad stomach or you'll get a little bit of drowsiness or something like that, but iske koi long term side effects we haven't really come across. Even in western studies I've tried to figure out ki iske kya side effects hain. Ha, there are contraindications of these medications in some ki in medicine ke sath aapko rok ke deni padengi ya aap in conditions ke andar prefer nahi karoge usko dene ke liye, but I don't think ki iske koi long term koi bahut negative side effects hain या any side effects हैं इसके negative long term. So long term safety is quite stable as far as the medical cannabis is concerned. Would you agree on that?
Yes, I definitely agree. In last 3-4 months, I have not seen a single case which has caused me any worries. People are taking it and they have been, and like I said, 15 days compulsory follow up हमारे यहाँ होता ही है. तो हमें पता चल जाता है. अभी तक तो किसी ने कुछ भी नहीं कहा है एंड आई होप अगर कुछ आ भी जाता है तो आई वुड बी फ्री. कई बार सिर्फ स्लाइटली जैसे कि बताया कि पित्तवर्धक है ये, तो अगर किसी को थोड़ी बहुत एसिडिटी या गैस्ट्रिक इश्यूज होते हैं तो यू कैन टेल देम, यू कैन गिव देम पित्त शामक औषधि. आपने देखा कि मोस्ट ऑफ द टाइम आई हैव गिवन कामदुधा टू माय पेशेंट्स. गैरिक, कामदुधा, लघु से सुचेखर कुछ ना कुछ मैं देती रहती हूँ, तो उसके साथ फिर कोई इश्यूज नहीं होते. अगर हुआ भी तो हल्का सा ये प्रॉब्लम हो सकता है. थैंक यू डॉक्टर.
All right, ma'am. I think we are running against time also. Thank you so much for joining today and collating this information. I hope we keep on doing these sessions with you on different topics. And thank you to Indian Vaidyas and Dr. Piyush once again for bringing us to this platform, so we are able to spread this knowledge. Thank you, Dr. Payal, once again, and to all the doctors who have joined us today. We will see you next Wednesday at 3 o'clock with another topic, another discussion. Thank you, ma'am. Thank you so much.
Thank you so much. Bye.
Thank you, sir. Thank you, ma'am.
Thank you, Devesh. Thank you, Vikram, and thank you, Dr. Piyush and Indian Vaidyas for this platform and this wonderful interaction today. And my thanks, welcome to the entire audience who was here today. Agar koi queries hai to later on they can contact me. My details are already on the screen here. Thank you.
Thank you.